Stories are how we understand people and understand context. And so they are an important tool for health communication. They're an important tool to actually draw out empathy, for people to understand history. It is probably, besides policy, mass media stories, journalism, they're probably the best way to reach people in terms of helping them understand context and culture. And so art heals. I think it's just as important as an intervention as masking, as vaccines, as medications for chronic disease. So storytelling should be a part of our toolkit in public health.
The APHA Film Festival has been going on for over 10 years. Putting it together is an extremely rewarding process. We screen films upwards of hundreds every year. We have a robust committee from all walks of life and educational backgrounds that really come together to make it an interesting, ethical, and solutions-focused film festival. It's an international film festival at that, so it's one of the most rewarding parts of my involvement with APHA.
My appointment with you, honestly, I thought was going to be a waste of time because everybody else turned me away. So when you agreed that I could try hormone replacement, and after 2 weeks of being on hormone replacements, it has completely changed my life. I'm sorry to be upset, but it's just, I felt like it was, I was my old self and that I was thriving in this world again. And I'm glad I went through with the appointment with you.
The name of my film is The M Factor, Shredding the Silence on Menopause. And it's about how women's health at midlife stalls. It stalls on getting health care, it stalls on being addressed, the women are dismissed, they are told that it's in their mind. And so we have had now over 2 generations of women suffering through the perimenopause, the menopause stage. We just like dropped her off a cliff, right? And said, we don't see you anymore. And so this film is about saying, we see you, we understand what's happening, we're gonna tell you it's not okay, and that you need to go and see a healthcare provider, one that can actually help you. Yesterday, after we screened the film, so many people said things they were going to do. And this happens every time after we do a film. They want to start advocating, either for themselves or for like the collective group of women in this life stage. So I think that's what filmmaking can really do at its best.
Once the doctor told me that I was going to be placed on a ventilator, I was very hurt. But this nurse, she said, I promise you, I'll do everything in my power to keep you alive. They prepared me to be placed on the ventilator. And upon them putting me on the table and get me prepared to go, all I can remember is counting backwards. And the last number I remembered was 97 from 100. I remember waking up 21 days later. And at that time, I remember I lost it.
Our film is entitled Unmasking the Truth, the Impact of COVID-19 in Albany, Georgia. The New York Times wrote about Albany, Georgia, that COVID hit like a bomb after a funeral on February 29th, 2020. And so this city is 75% African American. It is the location of Dr. King's only unsuccessful march. W.E.B. Du Bois wrote about this city, but there are just a lot of issues. I think it illuminates complex public health issues in terms of systems, our communities, power dynamics, loss, grief, the loss of rituals. The film itself has everyone in there, from the hospital system, epidemiologists, families who lost loved ones, those who were impacted in terms of illness or burial, as well as faith leaders, social justice advocates. And so it's a very important film because everybody there is a part of the ecosystem in public health.
Filmmaking, it's, I think, an important and effective tool in public health intervention. It's not specific to any state, any city. It's a powerful tool in any locale or arena. I hope that attendees look at these films and are inspired into action. We feature films that are actionable, so attendees can take something home that they can act on the very next day. And we also have workshops in where attendees can collaborate with filmmakers and each other to turn filmmaking into action.
A 10-minute story can help and tell a lot, and that can be used in so many places to help people. So I would say don't always think that it should be seen by a gazillion people on Hulu or Netflix, but seen by the right people can make a difference.
Health communication should be the first person at the table in terms of working with the epidemiologists and statisticians and policymakers. We don't work in silos. We need people. We are people. We are the community. And so we work at the forest level, and we're just as important as the doctor, the clinician, the nurse, the doula, right? And so storytelling is an art, and it is a part of the public health team.